This segment is sponsored by iChiro Clinics and Peak Performance Integrated Medicine. Founder Dr. Michael Quast is here to talk about knee pain, something you've been hearing a lot about lately, Dr. Quast.
Yeah, we're seeing quite a few people who are having knee problems and, not really sure what to do about it. The traditional method of just taking painkillers and waiting until your knee wears out completely and you need a joint replacement. A lot of people are looking for other options besides just that. So
So,
they've been,
do you know what is causing the pain?
yeah, so a lot of people with joints in general, think that the joint is worn out simply because it's old. And a lot of times we'll see this, and age is a condition, like that's a problem. That's a thing that happens. We do all wear out as we get older.
Yeah.
However, um, there's more to it. And a lot of people don't realize there's more to it. So, for example, if you had a car and you were driving around and one tire is wearing out on that car and you took it to your mechanic and he said, must be that's an old tire. You wouldn't really be buying that story because all the tires are the same age. What it is that car's alignment and how it's working is putting too much pressure into that tire, making it wear out faster. And what we see with the body is similar, where you see somebody whose knee is worn out, but their other knee is fine. And they're the same age. So if it was just age, it wouldn't be that way. In fact, if age caused the degeneration solely, then every joint in your entire body would be worn out exactly the same because your joints are all the same age, right? So it's commonly misunderstood.
Yeah. So is the answer to degenerated joints replacement when it comes to knees, or can you do something to heal it and fix it minus replacing the joint?
Yeah, so I mean, there's always options, right, to see where somebody's at, depending on how severe things are. But we always like to start with the safe, conservative stuff first, and do those natural things first to try to get things as good as you can. And then you move along that riskier pathway with surgery, ideally being your absolute last resort. And so when we see patients who are having problems, there's so many things that can be done to try to correct why that joint, like for example, a knee joint is having so much pressure coming into it. And often it's muscle imbalances, compensation patterns, injuries and traumas that have damaged muscle and tissue that have never been rehabbed properly. And so now that joint is getting compressed and pressure all the time, where even if you do something for that, like a knee replacement, a lot of times those wear out themselves after they've been done 10 or 15 years later. So not that those are all bad. Sometimes people need that. But what I'm saying is there's a lot that can be done in the rehab realm and then in the regenerative realm. And so what we find works best is if you, number one, work on the tissues that are causing the joint to be worn out to begin with and get those to be better, fix the compensation patterns, change that muscle and tissue. And then two, do anything we can to try to regenerate the cartilage inside the joint using the human cellular tissue products, PRP. There's different natural things that we can do to try to rebuild any of that cartilage and tissue with the medical team. So they can do that. We can do the therapy end. You put them together, and that's how we're seeing the best results for patients.
And you're really applying that whole rehab and regenerative care concept to a lot of what you're doing at iChiro, right?
Yeah, so when we teamed up with the medical team, it's because it makes sense. So if you only do therapy, you get a certain level of results. If you only do the regen, but you don't fix why the joint worn out, those people don't get as good of results either. But when we combine these two together and we're watching and measuring how things are changing, how the function and mobility is doing, that's how we get the best results. And that's kind of our secret sauce, what we're doing that's different
Yeah.
from everybody else around is we're combining these things together. And that's why it's peak performance integrated medicine, because we're pulling it all together because what we care about is getting patients results. Our product is your quality of life, not doing procedures on you. It's your quality of life. So we want to do whatever we can to try to get that patient's mobility, function, and quality of life as high as possible.
All right. It's iChiroclinics.com, iChiroclinics.com. Dr. Quast, thank you so much.
Thank you.